We're broadcasting from the Middle Tennessee Electric Studios.
Visit MTE.com.
Middle Tennessee Electric, serving to make life better since 1936.
This is a WGNS Action Line. Talking with Rutherford County newsmakers
since 1947.
This is a WGNS Action Line. Now, your host, Scott Walker.
In studio joining us this morning, Dr. Craig McCabe from McCabe Vision Center, and he is live in studio. How are you this morning?
Good. I'm glad I'm not dead in the studio.
That would be awkward, you know. How would we get any questions answered at that point? You know?
Oh, it'd be a very stiff conversation, I guess.
Ah, man, it would be.
So anyways, I hope everyone had a great weekend. I hope, like me, on Saturday, they got their yard mowed, trimmed, whacked, everything ready for the rest of the week. And hopefully it's not going to rain as much this week. What do we got on the weather, Scott?
Lots of rain, 90% chance all day today. Well, I think after 12 o'clock or so, it's going to last into the early morning hours into tomorrow, it sounds like.
Oh, so another good day to be a duck in Murfreesboro.
That's right. You don't want to be outdoors. Anyway, yeah, hopefully everybody got their yard mowed already.
Right. Well, the weather, temperature-wise, has been nice.
A little humid.
Yeah, the nice thing about the rain is that it washes away down the sewers the pollens.
It does, yeah. And that helps because, man, I'm already feeling it, you know?
Yeah, well, you can still have the indoor pollens, and you still got to remember to change your filters on your cold air returns to help keep the inside of the house clean from pollens.
That's right. They build up so quickly, and man, those filters inside your house, do you notice how fast they are just covered, especially during the summertime?
Yeah, that's true, and I guess we bring a lot in because we're going in and out of the house probably twice as much. But so with your eyes and allergies, like we've talked about before, there are the antihistamine eye drops that you can use over the counter. Pataday seems to be the one that has the best results. And if you have more than that with your sinuses, then prescription medicines that are antihistamine nasal inhalers, as well as over-the-counter steroid nasal inhalers, really work very well. So there's really no reason nowadays to suffer with sinuses other than just a little bit of an inconvenience if you're using these medications.
I saw an inhaler yesterday, and I think it's a prescription inhaler, but you put it, part of it goes in your mouth, the other part goes up your nose. I've never seen anything like it. I didn't even know stuff like that existed for allergies.
Wow, nose and mouth, hitting them both at once. Well, I guess one way or another, the medicine's getting in you. But of course, if it gets in by your sinuses in your nose, that's the most direct route.
That's intense. Nose and mouth.
Yeah, that's when you're committed, fully committed
right.
to that medicine.
No turning back on that one.
Right.
We already had a question here. It says, my doctor prescribes me prescription antihistamines, and they make me very tired. Will this wear off? Can I take them at night? What can I do?
Well, of course, taking them before bed is great because it helps you go to sleep. But taking them during the day, and if you have to work or drive the car or anything, heavy machinery, anything also delicate that requires concentration, it doesn't work well for that.
No.
And there are several antihistamines that don't make you tired, and just call your doctor and say, hey, this one's making me really sleepy. I can't do the things I need to do. Is there an alternative? And they'll get you an alternative.
So if it does make you tired and you take it at night, which sounds great if it helps you sleep a little bit, does that tiredness usually wear off by the morning, and will the antihistamine still work?
Yeah, well, they have a time span with which they work. If they're a once-a-day medicine, then they're supposed to work 24 hours.
So it should be okay to take at night.
If they're a twice-a-day medicine, then, of course, they only are effective for about 10, 12 hours. And those, of course, you don't want to take at night, because when you wake up, you won't have any protection. But a 24-hour one, take at night, that may help two things. So that would be good.
Not bad. I have a question here texted in. And by the way, folks can text us at 615-893-1450. But this question is asking, what's the biggest mistake that people make when wearing contact lenses? Wow,
what a thoughtful question that is. Thank you to whoever sent that in. And please, right now, and anything's fair game here, send us in your text. It can be about allergies, like we're talking about now, or it can be about glaucoma, macular degeneration, cataract surgery, contacts, like we're talking about, glasses, diabetes, diabetic retinopathy, all these different kind of things, or any of your symptoms, or maybe you're having problems and you've seen a couple doctors and haven't gotten them fixed. Text those in and we'll give it our best shot. But as far as contacts, they're considered a medical device and you have to take good care of them. So you don't sleep in them. If you have the 2-week replacement contact lenses, then in between, after 1 week, you should be cleaning them with a peroxide cleaner. The most common one at the drugstore is called Clear Care. It's been out for decades and it works great. Just make sure you use it right and you're not putting peroxide in your eyes. When it goes in its little cylinder case and you see it bubbles, that peroxide's turning into oxygen and water. And those little bubbles are that bubbling off, but it's also chewing up the proteins and debris on your contact lenses. And when you take them out the next day, boy, they're pristine. Really helps the way they feel, your comfort, and even your vision. So do that if you're wearing contacts. And, it's just kind of common sense, like so many things. If your eyes are turning red and hurting you, you shouldn't be wearing your contacts. That's why you have to have a pair of glasses. Don't rely on your contacts all the time because you may have an issue where you shouldn't be wearing them.
I hear about this common sense stuff. Is there a degree in common sense that folks can get?
It's not taught very well in school. They assume if you take a variety of subjects, it will build with time and that your parent or parents will help instruct you to build your common sense. And a lot of times it comes from learning the hard way, right?
Yeah.
And if there's anything good that comes with getting older, it's building up your common sense from learning things the hard way. But you don't want to learn the hard way with your eyes because it can cause permanent damage. So now just do the basics with the contact lens. And whoever's providing your contact lens should be going over these basic instructions with you. That should be included in the fee that's charged to you so that you don't have any problems, because certain things, infections and corneal ulcers and things that can result from it can be very significant and never to be taken lightly.
Again, we're talking with Dr. Craig McCabe this morning of McCabe Vision Center. And if you have any questions, text them in, 615-893-1450. The next question says, as I get older, and I recently turned 40, which it's not that old.
It's all relative. So if you're like us and you're looking on it past that, it's like, oh, that's a young whippersnapper.
That's right. It says, why do so many adults suddenly need reading glasses when they hit their 40s?
Wow.
Is that true?
Yeah. Now there's another thoughtful question. Boy, we have
one to make you feel old.
We have lots of intelligent, common sense questions coming through today. But the reason is because the lens in your eye, which focuses to help you read, that is a tissue in your body, one of the few ones that never stops growing your whole life. Most other tissues do, but not that one. And it grows in a confined space. So instead of getting larger, people say your cataracts are large. That's not true. That's incorrect. What it is they're dense. They get denser. They grow like the rings of a tree, but instead of the diameter getting wider, they get denser because they grow in a confined space. And it is the softness of the lens that helps it change its shape for you to read and see up close. And so it starts when we're little kids. Cataract formation. No way, that can't be true. And it's true.
Man.
So when your kids are 1, 2, 3 years old, how far do they sit away from the TV to watch it?
Close.
Like 2, 3 feet. If we tried to do that, we'd get headaches in about 10 minutes, right? So can't do that. Well, why is that? Why can they do it? We can't. Well, it's because the lens in their eye is soft and it's able to change its shape enough to be able to focus on a big, bright TV a foot or two away. And then it's like being at the IMAX. And boy, watching all these silly cartoons at the IMAX, that's great when you're a kid. So that's why they do it, because they can. Now, what about when they're 5, 6 years old? Are they sitting that close to the TV anymore? Nope. Right? They're about 4 or 5 feet away, right? Because if they sit that close, it bothers them. And that's because the lens has grown. It's gotten a little bit denser from 1, 2 years old to 4 or 5 years old. And that continues throughout your life. And then when you're in your 40s, it's not you moving the TV farther away. It's you moving your reading material farther away. You can't hold things real up close to your face like you could when you're a teenager. Now you got to hold them out further. Why does that happen? Because the lens is growing and getting denser. And then what happens in your 60s? The lens has gotten so dense that light does not go clearly through it anymore. It gets scattered. And that's why the hallmark of cataracts is glare and halos, or the scattering of light in your eye from oncoming car headlights and other bright lights. And that's when you need to consider having the cataract operation done. When you're in your 40s and you have to hold your reading material, your arms are no longer long enough, then you need to help the lens because it can't change its self enough to change the shape to give it power for reading. And you've got to add some power to your eyes. And you do that with reading glasses. Or if you're a nearsighted or farsighted before, you do it with a bifocal or a progressive, no line. So that's the reason.
Can you damage your eyes with buying these, the readers at the grocery store and whatnot? Can they lead to damage if you buy the wrong ones that are too, magnified?
Well, so let's talk about that for a second. When you're buying readers, and let's say you're 45, you typically need about a 1 1/4, 150 add. And then when you're in your 60s, you typically need a 250, 275, maybe a 300 add. Well, why do you need more power? Because that lens can't change its shape enough, and you've got to add more power to it. Now, at an earlier age, when I told you need like a 150, if you get a 250 then, the magnification or that number is inversely proportional to the distance it focuses from your face. So the higher the number, the closer it focuses. The lower the number, the further. So if when you're 45, you get a 250 add, for it to focus, you got to hold it up about 8 inches from your face instead of 1.5 feet or so, which is normal. And if you wear something that focuses up close and you're holding it far away, that causes eye strain and blurred vision. It's not the right power for you. So you can get eye strain. Also, they have the same power on the right lens and on the left lens, on both sides. Well, a lot of people, their eyes need a little bit different power on each side. And so you get eye strain from that. Another thing they don't do is they don't correct astigmatism, which is kind of like the third component from nearsightedness, farsightedness, but they don't correct astigmatism, so you'll get some eye strain from that too. So you might have some headaches, or you can't look at for things as long, you're rubbing your eyes more, your eyes feel tired. All that decreases your performance at reading or looking at things up close. And that's why a prescription pair is the best pair. And if you have some difference in your eyes, you have some astigmatism, you need some nearsightedness or farsightedness correction, well, then prescription ones are going to by far be the best ones for you.
This next question is interesting, and the person writing it, I can only assume he's a man taking anonymous text questions to the extreme. He's asking, he says, Dr. McCabe, can you help my wife and I save about a $200 vet bill? She's beautiful, comma, my wife, but
Not
our
the dog.
but our dog has vision, or at least his eyes look cloudy, and I keep telling her it is glaucoma in our dog, but she insists it could be something else. Can you save me a $200 vet bill by confirming this could be a glaucoma?
Well,
do
first
dogs
of all,
get glaucomas?
absolutely.
Interesting.
Absolutely. Their eyes are very similar to ours. First of all, if your dog's having a problem and you love your dog, and you want to care for that dog, then you should take him to the vet.
Or if you love your wife in this case.
Right.
If you want to save your marriage, take your dog to the vet.
He already said she was much more attractive than the dog, so that's a good start.
It is.
But you want to take care of your animal, and when you get an animal, that's one of the responsibilities. You take him to the doctor.
Yeah.
Now, I have a medical degree, like most other doctors that see humans.
We hope they have.
And that is specific to humans. I'm not allowed to treat veterinary animals, and vice versa. So the vets aren't allowed to treat humans. And if we do, we can lose our license. So I'm afraid I can't save you that money. And then the second point is, if your dog has something wrong with its eyes, you should get it looked at. Come on, man, spend a few bucks, take care of your dog, right? Mm-hmm. So I'm gonna stand up for the dogs of the world right here.
What is it? Happy
and say
wife,
that, and
happy
I'm gonna agree with your beautiful wife on this one. So that's what I would say. Now, if your dog has glaucoma, you should be on glaucoma eye drops, medications, and your vet will write you prescriptions so that your dog will be able to see longer throughout its life. But I think your initial evaluation of your dog's eye may be incorrect, and your wife may be more correct, and I'm sorry. But glaucoma typically does not give an eye a whitish appearance. A corneal scar and cataracts do. Sometimes infections, but usually not glaucoma, unless the pressure in the eye is so high and your dog would be in significant pain with that. But in any case, you go to the vet and the vet checks it out and will tell you what it is. But usually with an eye problem with a vet, you have to see a veterinarian ophthalmologist who's a specialist. And I believe we do have one in Murfreesboro now, and there's one or two in Franklin, and there's a couple in Nashville. So they're around, and they are more expensive. So maybe getting the dog insurance for medical things would be a good idea if you think you're heading down that road. But take care of your animals. They love you, right? Unconditionally.
They do.
They love you. So take care of your animals.
I had no idea we have veterinarian ophthalmologist.
Oh, yeah. And they cost more to see because they're a specialist. So, yeah, that's true. But if they can save your animal's vision, then you'll have a happy pet that will continue to love you all their life.
I like the way some of these questions are phrased. They're catchy.
Yeah, they're fun.
Interesting.
They're fun. Good jobs.
This one says, I have what you call a teenager, and they insist on leaving their TV on when going to bed at night, and I at least suggest turning it on the blue light to help them sleep, but they insist on not changing it because they say it makes the screen too yellow. What do you have to say about blue light screens on TVs? And
So-
I know what they mean. You can push the little, button and it changes to kind of a yellowish color.
Yeah, and the answer is you're both right on this one. By having, and it's not a blue light, it's a blue light filter. Because, when we look up at the sky, it's all blue light.
Yeah.
Now, the sky's not really blue. I hope you all know that. It's just that the light that comes through the atmosphere, the blue light scatters to our eyes and we see that. But it's actually perfectly clear. That's a vision change that is just you see what color light comes to your eye. The reason my shirt is red today is because red light is reflected to your eye, and the same thing with your green one, and we have dyes and fibers that do that. But the reason why black is because no colors are reflected to your eye, and white because all colors are reflected to your eye. Isn't that interesting? But anyways, the blue light, which through evolution and eons helps to keep us awake, and our brains are sensitive to that, to a little gland in the middle of our brain called the pineal gland. So it activates our RAS, reticular activating system, in our brainstem, and does several things to help increase our alertness, telling us it's not time to sleep. And the same thing happens with video displays, whether they be a TV or a cell phone or an iPad or what have you. And that blue light helps to keep us awake, which of course is not good when we sleep. So the blue filter is a good idea. Another good idea I suggest is having a timer. And then the third thing probably is you just don't want to get accustomed to having noise and flashing lights on when you're trying to sleep. It decreases your sleep. You don't sleep as well. Your sleep score, if you're following that on one of your smartwatches, is not going to be as good. You're not going to get into REM sleep as much and go through the normal sleep cycles. So I would say try to get away from that. Maybe if you had to have anything, some kind of noise in the room, it would be some kind of white noise or pink noise, which can help you sleep. But, some people have to have the TV on because they've done it for years and years and years. And so with your, what appears to be a teenager, as you put it, I would, and teenagers are wonderful, and you're going to be so sad when that teenager's gone. So appreciate all of their little idiosyncrasies and help talk them through it with common sense. But some people need it, and it's tough, and I understand. But you're both right. But the blue light and the filter's good. Does change the colors. You're both right.
Isn't it crazy how fast our kids age? I mean, you just blink your eyes one day and they're, 25 years. It's just crazy how time flies.
Yeah, and time flies whether you're having fun or not. That's another one of my sayings. But anyways, I am the fortunate grandparent of twins.
Wow.
And a few days ago, they turned 6 months old. So I called up Mom, my daughter, and wished her a happy half birthday. And, she's like, they grow up so fast. They're only 6 months old.
Yeah.
And the thing is, you only get so many months of your baby when they're crawling before they're walking. And then you only get so many months when they're learning to talk and they're so cute. And you only get, a few years when they learn from you and they believe everything you say, is the honest to God truth, and you're right, and they look up to you for everything. And then things change as we get older. And so appreciate every little time span of those because they are fleeting.
And grandkids are the best. They're better than your real kids. I think it's because you're able to kind of sit back and enjoy them more so and actually, understand and enjoy those childhood parts of life where it's like, wow, this is really cool. Why didn't I enjoy this when I had kids that age, but then you realize, well, it's because they were always getting in trouble.
Well, I think you've been through it once. And when you've been through it the first time, it's all new and it's really a struggle.
It's like, whoa.
And you don't know if you're doing it right. There's another thing that's not taught in school. So taught in school should be how to raise a family, how to be good to your partner, how to manage your bank account, how to save money. All these kind of basic common sense things to life should be covered in high school. So there's my rant, my soapbox for that. But yes, you're all right about that. And so, but for us, all our days are numbered, right? Yeah. So we need to try to enjoy each one, try to bring down the hate and the anxiety and the frustration and the meanness and all the negative things. You only get one life. Try to enjoy it as much as you can, and you'll make others around you enjoy it more because of that.
If only we could live in a Leave It to Beaver society where everything's perfect all the time and Dad always has the right answer.
Well, now come on now. That beaver, every week he got into trouble.
Yeah,
that's right. Or what was it, Wally? Was Wally his older brother?
Was it
Wally?
Dating
myself. Anyways, somebody was getting into trouble. And that's the way life is. And it's not really that you get into trouble or stuff like that. It's how you get out of it, how you handle it, and how you learn from it. Again, learning common sense so that it doesn't happen again.
Here's another question for you. This one is asking, this is a pretty common one. Can rubbing your eyes actually damage your vision long term? Because my mom always told me never to rub my eyes.
Oh, but God, doesn't it feel so good when you do it?
Especially during allergy season.
And most times when things feel so good, they've got a negative side to them, right? And rubbing your eyes is the same way. So rubbing your eyes releases what are called inflammatory molecules from your eyelids and from the glands there. They're called cytokines, and they're destructive to cells of the epithelium and such. And if you already have a dry eye or blepharitis or acne rosacea or any of these kind of issues, which causes a mild level of almost constant inflammation to your eyes, then you're more susceptible. So yes, rubbing your eyes for long periods or shortly over long periods can be damaging. Another thing it does is it encourages stigmatism and corneal changes. It's thought that a disease called keratoconus, which is thinning of the cornea, which causes huge amounts of irregular astigmatism and is hard to fix. Sometimes you have to have a corneal transplant for it, and I don't want anybody to have that. That's a very tough thing to go through. Also, it makes your eyelids not as strong, your upper eyelids. It tears away at the attachments from what's called the levator muscle, which elevates the eyelid up to open your eyes. And if you rub your eyes a lot, you'll get these bedroom eyes. Your eyelids won't open as much. Your eyelids will droop more. And that's because of years of rubbing have broken those attachments that it needs to pull the eyelid up, and it droops down some. And then you have to have a surgery to correct that.
So stop the rub.
That's right. With the eyelids, instead, so let's flip this, right?
Okay.
Let's not make negative. Let's talk about some positives. So instead of doing that, put an artificial teardrop in. Lots of times it's a dry eye issue. They're very soothing. And if you put one drop in each eye and then close your eyes for 30 seconds, think about what you got to do the rest of the day. Yeah. Organize your thoughts. It's a great thing to do anyways. But do that then. You'll be productive. And oftentimes when you open your eyes for 30 seconds, you're like, wow, it does feel better. I do not have the urge now to rub them like I did. But lots of people, it becomes habit. Some people do it in their sleep, immediately when they first wake up in the morning, yada, yada. And then over years, they'll get the droopy eyelids.
So I'm curious if it's just me or if everyone feels the same way.
Oh, it's you, Scott.
Just
it's definitely
me then. Okay. I was going to say, when I have dry eyes,
right,
that feeling of the eyes being dry, it makes me feel tired. Something about it. It's just, this horrible nagging feeling in my eyes, like I've got to close them because they're dry,
And you look tired,
obnoxious.
and you look tired to other people.
Yeah.
Yeah, it's not a good
so
look.
Uncomfortable.
It's not a good look. So, put an artificial teardrop in. And lots of times when your eyes feel tired, it's because they're dry. So if they feel scratchy, gritty, sandy, blurry, irritated for any reason, or blurry, let's just make it simple like that, put an artificial teardrop in. And they're not that expensive, and they're over the counter, and you can get them everywhere. Just get a brand name, and you'll do well.
Again, in studio with us this morning, Dr. Craig McCabe of McCabe Vision Center, and you can find him online at McCabeVisionCenter.com. But you can text us any questions you'd like at 615-893-1450. Here's another question. What is one eye health myth that you wish people in Murfreesboro would stop believing? Or is there one eye health myth that you hear about often that's not true?
Ooh, this is like a stump the doctor question. Now I really got to think. Eye health myth. So you believe something to be true when it's not. Okay. Here's my favorite one, which is also probably one of my largest pet peeves. And that is, well, it's okay. It's not that bad. It'll get better. Give it some time. Now, if your eyes are all red, that's probably not the case. If your vision is worse, that's probably not the case. And you're probably belittling something that could go from little to a bigger problem by ignoring it. Now, if you've got a little rash on your arms, you've been out working in the yard, if you got a little sneeze or a cough, and that's all it is, that's something you can wait on a few days. But for your eyes to not see as well, that's not normal. Now, again, this is common sense. That's not normal. Put some artificial teardrops in. If that doesn't make it better, it's time to call your eye care professional and get an appointment and tell them your eyes are hurting, you're not seeing as well, and that this is a recent sudden change. So that will be my one point of the day, that don't take your eyes for granted.
Again, Dr. Craig McCabe in studio. We're going to take a very short break, and when we come back, we'll try to get to your question. You can text us at 615-893-1450, and we will be right back.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Hi, this is Dan with Music World and Drummer's Den. Our prices are as good or better than the box stores. I don't think you'll do better by shopping online than you would by coming in. Something new we've just added to our repertoire is drum repairs. You can have drums cut, covered, rewrapped, new hardware. We will fix them, make them look like new again. I'd like to thank you for coming by to see us again at 2762 South Church, right across from the golf course. Music World and Drummer's Den. Thank you very much for being our customers.
Need a new set of tires? Head to Tire World, where you can buy now, pay later. Ask your Tire World experts in Murfreesboro, Smyrna, and Laverne about their financing options.
Tire World, we keep your family rolling.
Get the Bridgestone affiliated retailer credit card.
My name is Mary Ann Letizia. I didn't drive at the other place I was at. Their transportation was kind of sketchy. This, you put a request in, he comes and gets you, brings you back. The people here at Adams Place really seem to care. It's genuine. And they really seem to be interested in your life, your family, your likes, your dislikes.
This is Terry Deal. Come tour Adams Place and discover living a dream in your senior years.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Again, in studio with us this morning, we have Dr. Craig McCabe, eye doctor with McCabe Vision Center. Again, he is right here in Murfreesboro. You can find him online at McCabeVisionCenter.com. And if you have a question, text it in, but Text quickly because we're almost out of time. Our number is 615-893-1450. This next one says, I've been seeing, or rather, I have not seen as many LASIK ads as I used to. What happened? Is this still a procedure that is being done today, and is it safe?
Well, yeah, it is. And I don't know whether because of cost issues, they don't have the advertising budget that they used to, or that now it's just a more common procedure that doesn't need to get the word out as much as it used to. And then also these multifocal lens implants for lens replacement or cataract surgery, which give you near, far, and in between vision, something that we specialize in at McCabe Vision Center. They have become more dominant, I guess, because they give you good vision for many, many years and help to get rid of your reading glasses. So they solve your distance, your intermediate, and your near need, and they get rid of cataracts all at the same time. Whereas LASIK just fixes one focal distance, but as long as you don't need reading glasses, then you can still read after you've had LASIK surgery, and it's a good procedure. My kids have had it. I've had it. It's a good procedure. No surgery is perfect. It does almost always give you a dry eye later in life. And so you have to use the drops and see the doctor and keep your eyes moist. But usually it gets you out of glasses for 10, 20 years, depending on when you get it done. And it's not that it's gone out of favor or anything like that.
I like this question here. We got at least two more, but I'm going to get to this one first because it's interesting. What is the most fascinating surgery you have performed? And many people may not know anything about that surgery.
Oh, wow. Another thinker.
What's the most fascinating surgery you've been a part of?
I don't know. 2 weeks ago, I exchanged a lens implant for someone that had cataract surgery that I did over 15 years ago. Before that, the oldest one that I'd ever exchanged was 3.5 years. And so I was worried about that and did some research and everything and, gave the patient informed consent, and they agreed. And it was because the lens in their eye had calcified, which is an uncommon thing, where calcium deposits accumulate on the lens to such an extent. And I tried to laser first to get rid of it. I couldn't, but there was no other way for the person to see it and have that lens exchange. And what happens is your body scars down around it with time. And so I had to cut it out with some little micro scissors. And the procedure actually went way better than I thought it was going to, fortunately. Knock on wood. I'm hitting my head now. And I expect to see them back this week. And so I'm really looking forward to that. And so that's one I don't know anybody around here has done that long out.
Do you know remember the Saturday Night Live sketch, the lady with the mini hand, the little micro-sized hands?
Yes.
Do you have to use like micro-sized hands to use those micro-sized scissors during eye surgery?
Well, I have pretty big paws.
You do. So I didn't know if you had the stand-in or
I'm a size 13
there.
shoe. I'm an extra large glove. So my feet and hands are pretty big. But you just, if you look at my hands, I have absolutely no tremor in them.
Yeah.
And I've worked very hard my life.
Literally held his hand up just then.
Yeah. And most people, when they do that, they have a little tremor. But it's because I haven't consumed hardly any caffeine my whole life. And so anyways, you just have to be very delicate and controlled and precise.
When you have somebody doing surgery on you, you want that surgeon to have tremor-free hands.
Yeah, you do. But no one ever asked to see their doctor's
Doctor,
hands.
hold your hand, please.
Not like that. Yeah, because most of them, most of us after 50, we get a little tremor.
Interesting.
Yeah.
Here's another one, and it says here, I know you guys were talking earlier about eye problems with the dog, the glaucoma, or whatever it was, but what are some warning signs for people to watch out for glaucoma?
Oh, there's a great question. And the answer is, by the time you notice it,
too late.
It's too late. Glaucoma is called the sneak thief of sight because it steals your vision from the periphery and moves inward. And you don't realize it till you have tunnel vision. So get your eye exam every year or two. If you've got no problems at all with your eyes, get them checked on, because you don't know when you have a problem. Oh, there's another myth. There's another one of those things. My eye wasn't hurting me, seemed to be seeing okay, so I'm fine. That is definitely wrong. You can't feel when you have high cholesterol.
That's right.
You can't feel most of the time when you have cancer. You can't feel most of the time when your blood pressure is elevated constantly. There's all these kind of things. And a lot of things your doctor doesn't know either. He's got to draw blood work to get done. He's got to send you to radiology to get scans to get done. That's the only way to know.
Yeah.
And you think you're going to know, and you haven't even been to med school or residency or any of these kind of things that we've spent years and years and years, and we still don't know. Yeah. So go get your routine health care done, and you will live longer and live better.
Thank you for joining us this morning.
Oh, enjoyed it as always, and thanks for all the wonderful questions. We'll be here again the second Monday of each month, starting next month.
Sounds great. Again, Dr. Craig McCabe with McCabe Vision Center, online at McCabeVisionCenter.com.